Welcome to the Premier Medical Plaza Lunch and Learn program. So glad to see we've had such a great response. On behalf of High Point Regional Health System, Premier Imaging, and Cornerstone Healthcare, thank you again for being here. We do host these Wellness Lunch and Learn programs once a month. It just proves to us that there is an interest in educational programs such as these. Again, on behalf of High Point Regional, Premier Imaging, and Cornerstone Healthcare, enjoy yourselves. I am going to turn this over to Sherry Nance, who is the Director of Premier Imaging.
Hello, everyone. Yay, thank you guys for coming and supporting this wonderful event today. I know it's going to be awesome. Thank you for wearing your pink. I see a bunch of pink out there. Down at Premier Imaging, we're on the bottom floor, and we have mammography, ultrasound, MRI, CT, X-ray, bone density, and we also do what's called Mam and Glam events. They're a lot of fun for corporations. If you're interested in anything like that, be sure and let us know. Contact us, get in touch with Mary Beth. We have a lot of fun with beauty consults, massage, refreshments, goodie bags, roses, and mammograms. So you guys enjoy yourselves today, and thank you for coming out. I'm going to turn it over to Pam Goldberg.
Thank you so very much, Sherry, and thank you for being a sponsor of our lunches. I am thrilled to see you all. We've been doing this for over a year now, and this is the largest crowd, which makes me realize what rock stars we have here today. And I want to say thank you so much for them to come, and thank you so much for all of you for coming. As Sherry said, we do this every month, except December. And I'm going to tell you in a minute, I'm going to tell you now, and Marlene Baruch, who I'd like to introduce in the back corner, who is with Cornerstone Piedmont Comprehensive Women's Center, who some of you may know, is going to remind you at the end about our next month presentation. So if you enjoyed this, come back. And next month we're going to have, on the 30th, it's always about the same last Wednesday of the month, Dr. Sarah Jacob of High Point Ear, Nose, and Throat is going to talk about achoo. Is that a good sneeze? Is it sinuses, allergies, or the flu? How to diagnose and treat the sneezing, stuffiness, and runny nose. So if any of you have ever needed to use a tissue, you might want to show up next month. But without further ado, I just want to say how excited I am that we have the opportunity to introduce in public for the first time this amazing new organization, this online community that two of my favorite people in the medical community are introducing. Dr. Chinnasami, any of you that know him, that know the Emory-Wood Hematology Oncology practice, know that he is a kind, compassionate, intelligent, witty, and all-around wonderful guy. And his wife is here, and I think she would admit that. I don't know, how long have you been in this community, Dr. Chinnasami?
Since 95.
Since 1995. So I can tell you that is, you probably have met him. And also, he is the founder of this new program, and he's going to tell you about it. And Mrs. Cathy Weaver, who is my oldest friend in North Carolina, in the interest of full transparency, and one of the most kind and funny people that I know, with an excellent background in healthcare, is the executive director of this program. So I think with these two, this is going to go international, and you will have the honor and the privilege, as do we all, of being here with them when they introduce the program. So let me please turn this program today, our Lunch and Learn, over to Dr. Bernard Chinnasami and Ms. Catherine Weaver. Thank you.
I got a mic. Well, that was a very kind introduction, but why are we here? We are here because everybody at some point in their lives have been touched by cancer, either by themselves, a family member, friends. It's a disease that does not discriminate. And unfortunately, it has devastating consequences in a lot of cases. But there's also hope, and the field of oncology is undergoing a renaissance right now. The field is exploding with information. Every day that goes by offers new hope for people. Now, I'd like to point out two things. There's two parts to cancer. One is cancer care, which is the treatment part, which is what we talk about all the time. It's medical oncology, it's radiation oncology, it's a surgical oncologist. It's all these intensive treatment-oriented methods. So the hospital, Cornerstone, all of us have wonderful teams to be able to approach that. But now let's separate that out to care of the cancer patient, which is a little different than treatment. there's so much more to care than just doctor visits. The last thing we need to always think about in cancer is, gosh, I got to see the doctor, I got to see the nurse, I got to get something done. There's much more to care than just medical visits. And so we have actually developed a program. It's always going to be evolutionary because we'd love your input on that, is to be able to help you form your own team. What do I mean by that? In the hospital, we have tumor boards, we have all that, which basically enable us to be able to discuss a cancer patient's medical care. Now, what about the rest of the patient, the person? Now, that's when we need to be able to not just keep it with the cancer doctors or nurses or hospitals or doctors' offices, but really keep it in the hands of the people who actually care for the cancer patient and the patient themselves. Too often, we take away the responsibility from where it really needs to be. It's the patient choice, the family choice. How do you form your own team on your own terms? Having said that now, how are we going to go about this? We have started a program which we call Guideposts for Strength, GPS for short, which is going to help start to move us in that direction. It is still a baby step. It's got a long way to go. But we believe that this is the way for us to go to really enhance cancer care and put care back to where it really belongs, make it patient-centric. I think that's the single most important thing. And it's just not about medical care, it's about everything else. And the most amazing thing happened when we decided to get started with this, is we got a groundswell of people wanting to help us. And you'll see when we point out the program in more detail, is that most people have actually donated their time. These are people who are extremely busy. But when we talked to them, everybody instantly saw the need. There was not a single person I talked to who really turned me away. And I think that's a testament to our community as to how vested we are in this. We believe that we can make a difference, and we as a team will make this difference. Cathy, as y'all just heard, was our executive director, and she was my first recruit into GPS. That's what I'll call us. And what we always talked about was how overwhelming cancer care is. And Cathy didn't mind me sharing this, but Cathy is also a patient of mine. And we've had a lot of time to look at it from both a doctor standpoint and a patient standpoint. And so I think that's what will make this ultimately be what it needs to be to each person, is getting a bunch of input on all of us. Now, Cathy has been in the healthcare field. Her husband's a doctor. So she has most things going for her. But when the diagnosis of cancer came up, it is still overwhelming. I don't care what your background is. It is overwhelming. Cathy, why don't you share with us some of your thoughts?
I was diagnosed with breast cancer in December 2009. And my background is that I lost my mother to breast cancer when she was 53, and I lost my brother to lymphoma when he was 34. So it's a scary thing. We know all too well the consequences. My dad, however, is a survivor of prostate and skin cancer, and it does sound like we grew up in Love Canal, but we did not. It just sounds like we're from a toxic waste facility. But when I was diagnosed with cancer, I had worked in public relations and healthcare for years. My husband's a doctor, my father's a pharmacist. I came home and was absolutely overwhelmed. In fact, I'll admit to you that it was probably 10 days before I actually picked up the handouts that told about my chemotherapy medicines. I didn't want to deal with it. I knew I needed to know a lot about the cancer, and I bought a box because it seemed like a way to try to restore some order to a life that had suddenly become chaotic. I went to TJ Maxx, spent $12.99 to get a box to stack things in. This box is really heavy. It's got everything from glossaries that tell you what every cancer term means, to descriptions of the chemotherapy drugs I was on, to camisoles that will hold your drainage tubes, to inspirational messages from friends of mine. It's a wonderful thing, but it's a lot to sort through. And I know that each one of you who's been confronted with the word cancer has found yourself buried under information. And frankly, you're not quite sure which piece to pick up next and which one's the most important one to read. What we are doing with Guideposts of Strength is that we are taking cancer care information and condensing it to a couple of portals that will make it very easy for you to get the information that you need. Right now, instead of needing this whole box of materials, except for a couple of things like my cell phone, I could go to an iPad and look at our website and find information from a pharmacist about my chemotherapy drugs. I could find information from a psychologist about how to deal with the grief that I felt over having mastectomies. I could go to this and find tips on how to keep track of the medications I needed to take. And trust me, even though you think you're totally on top of this, there were days that I couldn't think straight and would forget medications. And as the daughter of a pharmacist, that's kind of embarrassing to admit. But we all need tools, and Guideposts of Strength wants to offer you a tool, a number of tools actually, that will make the journey a lot simpler. The journey's still going to be tough. We're not going to try to convince you that this is going to be a happy time, but there are a lot of great things that do happen along the way. We just want to be able to help you avoid the detours, to avoid a lot of the speed bumps in the road, and to help you make decisions, because there are going to be junctures from day one where you decide to go this way or that way. And we want to let you remain in control and not feel out of control with cancer. The first thing I want to do is show you a video, and this is going to be where I'm a little out of my element to make sure I can get it up on the screens just right. This will help you understand the origins of Guideposts of Strength.
It's just 5 minutes.
One of the first clues that I had of the importance of cancer mentors, and then in a formal way at the time, was as soon as I was diagnosed with cancer, 2 people in particular came to me and wanted to help me through the journey myself. And they were a phone call away all the time, through the surgeries, through the chemotherapy, even through waiting for the first test results, actually. And they were always available to talk with me about what to do when you felt nauseated, or how to handle losing your hair. 2 women that were just really sisters through the journey to me. And it bothered me when I go into the chemo room and see people there all by themselves. And some people go for chemotherapy, for any of their treatments alone, out of choice. But some people go alone because they don't have anyone to go with them. And distinctly, I remember sitting there thinking how hard it must be to not have the support.
Cancer is probably the scariest one somebody will hear in their lifetime. It doesn't matter if you're a captain of industry, you're a doctor, you're a lawyer, you're an engineer. It's an equal opportunity disease. And the first thing I see in their face is fear, despair, and dramatic loneliness.
It's like a flash flood when the ground can't absorb the rain when it falls so quickly, and the water runs off into the streams. That's sort of how that diagnosis was to me. It all came on me. You've got the emotions, you've got the fears for your family, and then you've got all the information. Suddenly you feel the need to be an expert about the type of cancer that you have. And you need to know overnight, and you need to understand the tests that are going to be done tomorrow, the implications of the tests that are being done tomorrow, the decisions that need to be made in the next few days, and the surgery that will occur in the next week. All of that happens so fast you really can't decide where to put your focus.
When Cathy and I started brainstorming on Guideposts, we were excited. We felt that we can make a difference. And Cathy told me something extraordinary. She told me, hey, I have purpose. And that's when everything clicked off for me. I said, that's what we really need to do, is when cancer tries to take something away, we need to give people purpose.
One of the things that has impressed me in working with just setting up the basic tenets of GPS, we did focus group sessions, not only with cancer survivors, but with the family members of cancer survivors. And I have been so honored and touched by the candor that these people displayed in telling us the intimate details. Husbands telling about cooking 4 different things for dinner just to try to find one thing their wife could eat. A son talking about looking after his mother and having to defy some of the other siblings' wants and wishes and bring his mother to live with him so he could look after her. They're very touching stories, and they're stories that I think lend a lot of support and a lot of credence to other people's journeys as well. And it's a real blessing that we're going to be able to help people share these experiences.
Any experience you survive or do well with makes you stronger. And what we learn from that, we then pass on to the next.
It doesn't mean that you're not going to have to forge your own path. It just means that we can help you avoid some of the potholes and the bumps in the road along the way.
This is our chance to set that right. Give every person a GPS to navigate this very complicated journey. And it is a hard journey, but to make it much more acceptable for them. And more importantly, for them to feel in control and never let cancer take away that hope or cause that fear, and therefore be a guidepost in getting them to the place they need to get to on the journey.
Well, having said that now, a lot of exciting things are going to be happening with GPS. And one of the main things is going to be our mentor program. Now, everybody would love to have a mentor. And I think cancer is one of those journeys which is very scary to take on yourself. Now, imagine what a great place would it be for you to have your own personal trainer to get you through this course. Whether it's not just by diagnosis, but by a whole variety of factors. So people are more similar to you, so they sort of think like you. Now, obviously, this is where we are starting from, so this is something that we expect to have grown over periods of time and years. But I think having somebody else you follow through their steps, to be able to call you at any given time, to be able to share these resources, tips, and thoughts would make your journey a lot more pleasant than otherwise. Doctors can feel empathy for you, but most of them have never been on this journey. So I think the credence of support from somebody who's actually done it before makes a huge difference in being able to follow advice and what to do. Now, it's not like people don't try to get mentors today, and we do try to match people up. But the reality of it is we don't really train mentors very well. What we hope to do in GPS is to be able to train mentors to be real mentors, meaning what? Knowing what resources there are, knowing what's appropriate to ask and what's not appropriate to ask, respect boundaries, respect confidentiality, and so have a real trainer, not just somebody who's been through the journey and are going to be victims of their good and bad experiences. It's rather somebody who can enhance how they can be a better mentor by being trained by us to be part of that. Now, this is not just for patients, because cancer is traumatic to family too. So I think it'll be nice for family members to be able to talk to people too. And I think because then you don't feel alone. You know that somebody else has done this and has gone through before you, and therefore can kind of help navigate you through that. Kathy, you want to add something?
One of the examples I can give you, and we've done some mentoring the last year to get the ideas of what would be helpful, what would not be helpful, how to set these boundaries. But one of the first people that Dr. Chinnasami asked me to talk with, shortly before her chemotherapy was to begin, she was very scared. She had children similar age to mine. Mine's 24 now. And she said, I do not want my children to worry. And she was adamant. I don't want them to worry. I don't want them to see me sick. I just don't want them to have to, put cancer in their life. And I hadn't been trained, but somebody helped me say the right words, which was, they're going to worry. But there's a way that you can help them cope with the worrying, give them something to do. And she had, we didn't talk about specifics. I didn't say you must let your daughter who's in college come do this for you, or that you need to let the one in junior high school vacuum the house or whatnot. But I went to see her when she had her first chemotherapy session. And a young woman stood up and hugged me, and I wasn't quite sure who she was, and she said, whispered in my ear, "Thank you for convincing my mom to let me come to chemotherapy with her." Now, I didn't convince her mom to let her to come to chemotherapy with her, but she heard, "Let your children help you." And I guarantee you that daughter who came to all chemotherapy sessions, her professor at Appalachian State University let her miss class those Tuesdays to be with her mother because that was a priority. And it dawned on me, gee, what a difference a little thing like that can make in that whole family's journey through cancer care. And so we are taking, in fact, you'll have an opportunity, there's a little card. Hold on, I'll show you what it looks like. It's a little card. You'll fill it out. You can tell us if you're a cancer patient. That means that you might be interested in being a mentor. You might be interested in being mentored. If you've been through the cancer experience, you might want to be a mentor, or you may want to volunteer with us in another capacity. Fill these cards out and leave us your information, and then we'll be able to get with you for training sessions for each of these areas, because we want to help you understand how you can do the best job at sharing all these important lessons that you've learned. I felt like for years that cancer had caused a lot of scars in my life. It took away loved ones. Physically, it's taken away part of my body. But finally, this seems like we can make cancer an asset. And every one of you in here who's been through cancer, whether it's a loved one or yourself, you know that you have valuable lessons, just like the one that I got lucky enough to be able to share with that one woman going into chemotherapy. And that's why we feel like all of you will build this program along with us.
Now, having said that, there are going to be many aspects to this that we are going to build. This is where we are starting from. There are going to be educational sessions. There's going to be, actually, we're going to do videos so people can actually go in and look at simple things. I have breast cancer. What does staging mean? You could click on staging. It'll take you right there. It'll give you a Cliff Notes version of it. This is not meant to replace doctors, nurses, hospitals, care. What it's designed to do is make you better informed so you can help yourself. If you can help yourself, you'll be the best patient possible. It's not about hiding information. It's about sharing information. It's about making all of us better at caring for other people or caring for ourselves. At some point, we're even going to have a segment that says how to make a better doctor, and we're going to get better comments from patients. I think doctors particularly have a lot to learn about that. So do nurses, but so do patients. So it's going to be a section that says how to be a better, and then we put in a blank. One will be what doctors think make difficult patients. One will be what patients think would make difficult doctors. So this is going to be something that we can exchange all sorts of information with. We're also going to give people an opportunity to celebrate lives in terms of don't let cancer define somebody's life. There are multiple ways in which we can do that. We want to be able to bring us together as a community to help each other, because that's our biggest strength, is each other. And if we can inform each other to do what we need, I think we'll be much better off. Now, I'll pick on a couple people in the audience, and Marissa, you'll be the first one. You want to stand up? Sure. Hi. Marissa is actually a designated psychologist and has been very kind to help us with a lot of things to develop for GPS. And Melissa, why don't you tell us your background? You got 2 minutes to tell us about yourself. And
No.
Well, where do I begin? I completed a fellowship in psychosocial oncology at Wake Forest Baptist. So we weren't there at the same time, but Bernie was there too for his postdoc training. And it was the one place where I figured that you didn't have to be mentally ill to benefit from counseling. And at least as far as the general belief in our culture is. Not that that's generally not true, but. So to be part of a team, to work with various disciplines, to focus on passion and to focus on wellness, as ironic as that is when a person might have cancer. But I really like to focus on resilience, and the concept of post-traumatic growth comes up a lot, and the fact that one needs to struggle in order to grow, and how growth can be very painful and in fact requires some discomfort. So I really enjoy working with patients, working with colleagues like Bernie, and I run the breast cancer support group. I see outpatients. My specialty is adults, and counseling. I do some assessment. And how's that, 2 minutes?
yep, your time is up.
And Marissa has provided us with, Dr. Kangan, and let me be professional here, she's provided us with incredible information, and I'll show you in a moment on our website where you can go and see her information. Everything from practical tips about how to just go ahead and acknowledge it's all right to be sad today. Now, don't let it go on forever. But I can be really bummed at having cancer for a while. But to look at what really tips over into depression, and there's the depression assessment that's on our site too. And as sometimes the patients may not be able to do it, you may need your close family, your friends to look at that. So if you're wondering how to help your friend, there are all sorts of ways that the website can address what you're feeling and you're wondering and frustrated with.
Julie, you get picked on next. Now, Julie is in charge of clinical trials at Emorywood and has also been very kind to help us with GPS.
I would say my journey began when I was about 14 and my mom was diagnosed with breast cancer. My mom was a single mom and I had a little brother, and kind of took on the mom role, not really understanding, the whole concept of what she was going through. So, as an adult, I was fortunate enough to be able to go on a journey of my own and figure out what she went through, because my mom was 72 weeks ago. So my mom was on a clinical trial, and once I started trying to figure out when I was in nursing school all about her breast cancer, learn all about it, then I started investigating clinical trials. And so I've been doing that for 15 years now. So that's basically why I am on this journey to pay back. And I have the best job ever.
And one of the beautiful things you'll see, particularly on Julie's portion of our website, Julie not only finds websites that share information with you, but she has found apps for your smartphone that help you. They're awesome. I mean, who knew that the smartphone, which typically makes me feel dumb, could actually help you? And it has things from medicine reminders to locations for clinical trials. I mean, you can go to the phone. Julie does. She whips it out, and it's like, I've got an app for that. She can tell you if your stage whatever cancer, where your clinical trial is and how many positions are left in it. It's really pretty amazing.
And my group of physicians that I work with couldn't ask for a better group of people to, to help assist me on making these decisions on what trials we do. We do a lot of clinical trials on standard of care, things that we already know works, but we're trying to find out what's better. So that's what's going on at Oncology. Dr. Chinnasami, Dr. Harisha, Dr. Yes.
Awesome. Well, but this is what's been the most exciting about GPS. I've really not had to twist any arms. I mean, people have been so forthcoming to be able to help us with this, and that tells you what a great need there is for that. Now, other fields we are going to be moving into is, and she's going to kill me for calling on her, is my wife, Nalina. She's a concert pianist, incidentally. Since I have no talent in the arts, I had to get somebody to kind of start creative expression. And she's our director of creative expression. You want to stand up? No. She'll kill me for this later, but anyway, got to pick on everybody here. And what that part of the portion is going to be is to allow people to express themselves in any which way, whether it be writing, drama, music, etc. You want to just give a 1-minute capsule about yourself and...
Well, my whole background is I'm the wife of an oncologist. So everywhere I turn around is everywhere I see cancer. I've not had any experience with it, but through here I have a lot of experience with a lot of patients coming to me with cancer. And I find that apart from just patient work, how the patients deal with themselves, is their creative expression. What it really means is you can forget about your cancer in expressing yourself in different ways. There are many ways you can express it. Some people just like silence. Some people want to express it through music, through art, through writing. There are different ways. There's not just one way. And that's where you've got to have that. I have a background I'm a concert pianist, and I'm a lawyer too as well. But I find myself helping GPS for a great cause. And so we're going to start the site. It's not here, but different sections where you can express yourself in a different way. Just not through your mentor. I mean, you want to listen to music or you want to write your own music. You want to read a book or you want to write your own book. In any way you can express yourself. And you can just free yourself from cancer.
Awesome. Awesome. So this is where we are going with the program. But no program is complete without having people interact with us, because this is our view of things, and it's just a couple sets of views. What we really would like from you guys is to get all your views on what y'all find beneficial, what y'all don't find beneficial, what's overwhelming, what's a better way to do things. There's always better ways to do things. And that's really what, we're not here to pat ourselves on the back. What we're here to do is give everybody the best chance they can to form a team that they feel will meet their needs. In other words, meet people at their need, not at our need. And I think taking it out of the hands of doctors and nurses and putting it in the patient's hands, I think will be the most profitable for every patient going through that. Now you can't hide there from behind me.
Marlene?
You got 2 minutes.
2 minutes. Well, my name is Marlene Baruch, and I am the breast health educator at the Human Comprehensive Women's Center. And I've already seen a lot of old friends in here, which is really good. I'm glad to see. I usually meet a patient when she finds out she needs to have a breast biopsy. And I just follow her through the biopsy. Hopefully that she'll turn out fine. But if it turns out to be cancer, I'm going to be her buddy, so to speak, through all of her treatment, her chemotherapy, she has that, her surgery, her chemotherapy, her radiation. So we're friends for quite a while, a few months. And I'm available anytime. This patient needs to call me, needs to come in. He just, a lot of patients just drop by unannounced. That's okay. I don't mind that. Or they call, they come in, excuse me, we talk about whatever we need to. And many times I think they feel freer to, sometimes they things to do that they want to say to the doctor. Female things that I do, I talk to the doctor about, I talk about. And I love it. And I have the best job, Julie. Did I do 2 minutes?
You did great.
Genetic counseling.
Oh, and genetic counseling, thank you. Yes, I do genetic counseling. That is for breast and ovarian cancer. And someone who has a very strong family history of either of those may want to consider genetic testing, because if you have the gene mutation that we're looking for, means there's something wrong with one of the genes. You were born with that. It does increase your chance of ovarian cancer. It increases your chance of breast cancer or a recurrent breast cancer if you've already had breast cancer. And we look at ages to an age of diagnosis of you as well as family members, specifically ladies under menopause age. If you have a relative diagnosed with breast or ovarian or several relatives, you might want to think about that.
Right. Now this is just a little bit of what GPS has. Now I'm going to pick on a couple other people who are not directly involved with GPS, but clearly mold the way GPS goes. Janet, you want to stand up from there? Janet's been trying to hide back there. But Janet is actually my counterpart in part of the things we do at the hospital. We work a lot together. And it's an exciting time for what's happening for us, in that we're all moving to a direction that's called service line, meaning pulling all components of the cancer care around the patient, basically. And Janet's helping us do it from the hospital side, and we're going to have all these multiple facets about it. Janet, do you want to give a 1-minute capsule?
That's a surprise. I wasn't planning for that. But yeah, we are very much trying to work together. This concept is easier to manage in a small thing like GPS, but we'd like to see the same kind of concept in all of healthcare, so that when you have a work cancer center, you can connect with the right person and we can point you in the right direction, whether that is internal medical care or whether it's the supportive care that you need, or whether it's trying to live right back around something like GPS. With that mentor, they can be your partner throughout the entire journey. So we're very much on the same page with you as you move forward to make sure that our patients are cared for totally, not just physically, but spiritually, nutritionally, psychologically, physically, even your fitness.
Awesome. So, but this is the direction we're all going in for cancer care. The nice thing about something like GPS, it's not meant to be an exclusive High Point thing or Triad thing or North Carolina thing. This is designed to help anybody who wants to help themselves. I think that's the single most important thing. This is not to be a tool to gain market share. This is not a tool to leverage something. It's a tool which is entirely altruistic, and that's what we've been funded to do. You'll see no advertising on it or anything like that. It's really so that cancer is bad enough. We don't need to make any other bumps in the road make it worse than it is. We need to be able to put it in a package that anybody can access, enjoy, being able to make new friends, traversing the journey, and sharing experiences. So from my standpoint, that's the direction we really want to take this.
There are a couple of points that I'm sure you're wondering about, and I want to explain these to you, and then we'll go into a session because we want to hear from you as well. Guidepost of Strength is a nonprofit organization. We have gotten our status from the IRS, so we're official. We are not part of Cornerstone Healthcare, nor are we part of High Point Regional, but we work in tandem with everyone. So I want to make that clear to you. We're not replacing services, we're actually augmenting services. And we are depending deeply on all of these relationships, not only in High Point, but in our region, our state, and we hope to grow beyond that. We're finding so many resources, and it's so energizing to see that people realize there's a little bit of a missing piece of the puzzle when it comes to cancer care. And so many people realize they have to make decisions and they're not sure how to go to the next step. And we want to help you take those next steps. So what we really would like to do at this point, there are a couple of things I'm going to mention to you while you're still seated. I'm not trying to get rid of you just yet, but I remind you, I really want you to fill out these cards and give them to us. This way we can contact you. We can tell you about the programs that we have coming up. We can tell you about new articles that are on our website. Today, for example, we have a new article on our website that Dr. Williford has written about breast cancer. And it's really a very uplifting, and I needed uplifting news when I found out I had breast cancer. Hang on, let's get to hers. Okay, she has this really great article about how we've made a major dent in fighting this disease. Now, as the daughter of a breast cancer victim, it was vitally important for me to continue to hear that this was not my mother's cancer. So we want to bring you updates like this from Dr. Williford. We want to explain items that are in the news. We want to tell you about medication questions you may have. We also want to share input from our survivors about, or other people on the journey, about tips that make the journey easier. So that's why we want to have your contact information. And one more piece of, one more little note about this, we're also going to give away a free GPS system, the kind that you use in your car. So if you turn your cards in, you're eligible to win that as well. And that's just for fun. That's not trying to promote anybody. We just want to make something fun. What we also want to do, and we're going to open things up to discussion in a moment, but you're going to find in your bag an index card. If there's a topic you want us to address, whether it's on the website or in a future educational session, please mention it. If there's something that you don't feel like addressing verbally or speaking up and saying here today, that's okay, write it down, because we're going to collect these, go through these, and help plan our website and our future education sessions from it. So that's why we want that information. If there are, I'm going to go back to our trusted experts. Right now, our experts include dentist, a family doctor, genetic testing counselor Marlene, a hairstylist, nutritionist, medical oncologist Dr. Chinnasami, Julie, our oncology clinical trials coordinator, pharmacist, our psychologist Marissa, and a surgeon. We're going to be adding an insurance expert very shortly, and I'm also meeting tomorrow with people we're calling our God Squad, a couple of religious leaders from the area who want to help people, because this becomes very much a spiritual journey as well. We're not trying to convert you to any one religion. We just want to help you with that part of the journey as well. So what we'd like to do at this point, I think this is the right time, don't you, to talk about what kind of things do you think you've learned, what's been the best thing about your cancer journey so far, if any of you have been on one. And we'll go to the other side of it too, because we know that it's not all happy stuff. What's been the best part about your cancer journey? If you had to just lift up something that stood out, because that's not a question you typically are asked about cancer.
Closeness.
The closeness.
I know you don't have that much time, and you really, like, my parents' cancer, you really didn't know when. So you didn't try to jam everything together, but you didn't waste any time.
Didn't waste any time.
You didn't, be taken for a blow before that, but we never hung up not saying I love you. We never left each other from not saying I love you. And just not holding back the mission we had. It was always go ahead with it, just we're not going to
The diagnosis is a wake-up call about the importance of the relationships in your life and the love and the support in your life. Yes?
But I had what I needed right here, not at that time. We had to travel away from home.
That's the convenience factor, because you want the best care, but to know you've got it and can be home in 5 minutes, because we don't live far from each other. It is, especially a couple of days after chemo, it really makes a difference.
We're opening up to general questions too, about what you'll see, questions, comments, snide remarks, anything. There we go.
Yes.
I'm a survivor, and so I would say one of the best things for me when we get choked up, it's okay.
This lady is incredible. She is doing very well.
One of the best things for me was that I had employers who took care of me. I'm a single mom, and I had employers who cared enough to hold my job, to work around my schedule for my treatments. So if there's one thing you might want to add to this packet, is how to be a good employer when you have
So
patients.
awesome.
It's a great idea.
You have someone who's your employee and working with them when they have cancer.
That, thank you.
I'm sorry.
No.
Go ahead.
I got a question. I'm a cancer survivor. Right now, my son is going through chemo. He had throat cancer. And he worked for a company, and he had insurance. And then he had to go to Cobra, and then he found out, I think it was last week, that they had canceled his insurance. And he had been paying it. They told him what he owed, and he paid it. So now he's worried about how he's going to do his chemo, with no insurance.
And what we hope to do is be able to find resources that are online and publish them so people can access those type of things. And that's a really difficult situation right now. And so as I didn't know so many things were available till I started looking at stuff for GPS. And so there are resources there, maybe something that doesn't meet everybody's needs, but clearly a lot more than what even we who are in the business know about. And rather than try to duplicate anything, what we want to be able to do is to be able to take it out there so people can actually know they exist, and then empower people to chase them down, and hopefully at some point have enough resources to help people fill that out too. So that's what we're hoping for.
Yes.
Don't make me pick on someone now.
I know this is very early, but at this point, other than being a mentor, what other opportunities for volunteer do you see down the road for now? And about how much time you might be involved for volunteering?
We are working with a big vision plan right now, and we know that one of the things that we're going to need, several things we're going to need help with. One is coordinating volunteers, just to have somebody there to be the traffic cop and say, we need volunteers today to help with this luncheon. We need volunteers to make phone calls to people about the next Lunch and Learn. Lunch and Learn is not our session, but a next education program that we have. So we know that we're going to have, one person cannot make all the contacts that are necessary. So we definitely know we need volunteers to help manage the volunteers. And we also hope to have resource centers. One of our grant applications that's in is to have a resource center in several places, including the oncology office at the Hayworth Cancer Center, the radiation oncologist office, the oncology office here, so that when your doctor says, gee, have you looked at the website about nutritional supplements, and somebody says, I don't have a computer at home, we want to be able to have a volunteer staffed at that computer who can sit down with you, take you exactly to that page, that tells you about nutritional supplements printed out for you, let you take it home. So we do need some people who are computer savvy to be able to do things like that as well.
But we really need volunteers at every level. I mean, this is just a ground-up movement. So, I mean, anything that, in any type of office situation, you have room to do anything. Any skill set is appreciated, to be bluntly honest.
I don't have a question, but I would just like to comment that I personally appreciate everything that I've heard today. My daughter went through breast cancer in 2010, and she's doing great today. And I was able to gather information, but I'm hearing the people component of the guidepost. And I really find out that I really need people there. So I personally appreciate
Thank you.
what I heard today.
That helps affirm that we're on the right track. And if we start veering off track, we want to know that too. This program is only as good as the input that we get from everybody. We've had focus groups, as we mentioned in the video. Sessions like this also provide not only a chance for us to spread our news, but for you to spread yours with us. And some of the tips, one of our favorite parts of our website, if you'll check it out, is called Shortcuts. And these are just little tidbits that have helped you through your cancer experience. My tidbit was pretty quirky, but that kind of fits with my personality. I found that a lint roller was one of the most helpful things when my hair was falling out. Because sorry, but your pillow's covered with it, it's worse than the dog shedding. And I kept a lint roller everywhere, and I got to tell you, it made a huge difference to be able to sweep it up, throw it away, and ignore it because you didn't want to pay that much attention to it.
Donna took care of that. She just shaved my head.
Well, I had mine shaved too, and then the little hairs started getting on my nerves, so I rolled my head. And it's a little weird, but I did it. But we laugh that little things like that make a difference. So we want tips that fall in all sorts of categories. Nothing is too simple or practical or too big and global for us to ignore. We want to know all these components. Because our organization is never going to be done. We're not going to be at the point where we think we've gotten it all right. We're just constantly evolving, and it's going to change with every person's journey. It's 5 to 1, so we go ahead and say the last few things, and we'll be around to talk.
Sure.
I have to have notes because I do have a little chemo brain left. There are two things on your table that I want to draw your attention, one thing on the table I want to draw your attention to. And you're going to see a little card with a key. Did everybody see this? Yeah. If you could take a few moments and write down a key piece of information that we could pass on. We want to give these out to people who are newly diagnosed with cancer. The definition of a key is a means of access or control. And you feel like you've lost control when you find out you have cancer. So we want to give some of that control back. And a key is a real crucial element to something. So if you just have a message that you can put on the key, you can put your name with it or not, it doesn't matter to us. But these will be handed out to people who are starting the journey. The second thing that I want to say to you is this. We thought long and hard about the name of our organization. And let me explain, yes, we did want it to be like a GPS system because that helps you get from point A to point B. It helps you through the journey. But the guidepost itself, a guidepost is somebody or something that gives direction and provides key information. And they generally do this when you're at a crossroads. That's what cancer is for all of us. It's a crossroads. But what I want you to take away from here is that every person in this room is a guidepost too. Every one of you says something, does something to someone who has cancer or a family member who's had cancer that inspires them and helps them take the next step. And we just invite all of you to join us as a guidepost of strength for cancer patients.
Just remember, you don't want to take any trip without a GPS. I don't think anybody should go on a cancer journey without going through GPS here. So
yes.
We appreciate all of you coming and supporting us, and thank you for everything y'all do. And we'll be here to take some questions for some time.
And Mary Beth has a formal wrap up to this part too.
Thank you. Wow, what a wonderful program and support system you have shared with us today. I just want to personally thank the two of you and all of your volunteers and staff as well. My mother is a breast cancer survivor of 11 years, and this would have been a wonderful program to have for her. So I hope each and every one of you are inspired and that each and every one of you feel as if you have a purpose. As Cathy said earlier, I'm not sure how many survivors we have in the room. I know there's a few, so bless each and every one of you. Bless each and every one of you that's had a family member or loved one that you've taken care of. And I would just like to leave with you. Please feel empowered to take care of your fellow family members as well as your friends and maybe some people that you don't even know by volunteering with the GPS program. Again, I probably thank you a lot, but we just appreciate you so much spending your valuable time with us. We hope that you found this time you've shared very beneficial and helpful. Please share it with the others that you know. I am going to let you know we do have a program coming up next month. Marlene is going to stand up and share a little more information about that. So I'll turn it over to Marlene, and have a wonderful rest of your day.
Thank you. I also want to say I'm so glad to see so many people here today. It's just wonderful. It's just such a nice turnout, and I do hope it's been helpful. And the next Lunch and Learn is going to be on November the 30th here in this room, 12 o'clock to 1 o'clock, just like today. And we're going to feature Sarah Jacob, who is an MD with High Point Ear, Nose, and Throat. And she's going to talk about, achoo, is it sinus allergies or the flu? I think that's a really great topic for this time of year, and oftentimes we don't know which it is when we have those symptoms. So keep in mind that date. You will need to RSVP as you did for this one, but hopefully you can make it. It's good to see you today. Thank you.